Urinary incontinence is the unintentional loss of urine that causes distress to a patient. Patients with incontinence usually complain of leaking urine ranging from a few small drips to their entire bladder. In general, there are three main types of incontinence, including urge incontinence, stress incontinence, and overflow incontinence. Urge incontinence typically occurs when you start to leak prior to making it to the bathroom in time. Causes for this type include diabetes, infection, inflammatory conditions of the bladder, and rarely a tumor in the bladder. Stress incontinence typically occurs when you leak with stress activities like coughing, laughing, sneezing, or exercise. Causes for this type generally include surgery, radiation, and having babies. Overflow incontinence typically occurs at random, but can occur with stress activities. Causes generally include neurologic disorders, including spinal cord injuries, stroke, and diabetes. You may be at risk if you have had one of the causes I just mentioned, though your overall risk may still be low even if you do. It is most common for patients to complain of leaking urine to their primary care doctor or urologist. Typically, we'll test your urine to rule out infection or other correctable causes. We may send you for an X-ray or ultrasound of the urinary tract to get more information. We could also perform an office procedure called cystoscopy to look inside the bladder and urethra. Finally, we could use urodynamics, another office procedure, to evaluate how the bladder stores urine and empties. The treatment depends on the type of incontinence that is present. Most forms of incontinence may respond to lifestyle changes like modifying how much you drink and what you drink and how often you attempt to use the bathroom. Urge incontinence may improve with medicine or other procedures to treat the bladder. Stress incontinence rarely responds to medications, but other things like pelvic floor muscle exercises, physical therapy, biofeedback, and maybe even surgery. Overflow incontinence typically requires correction of the cause of the overflow. This may be accomplished by using a catheter or having some procedure to help the bladder empty. Don't hesitate to see your doctor. Most of the time, this issue responds well to lifestyle or dietary changes. Sometimes medications can help. If needed, minimally invasive procedures or surgeries are available that can improve or stop the incontinence altogether. Our clinic offers friendly staff that will perform a thorough evaluation of your symptoms, including in-office testing and procedures, as well as offer up-to-date treatments for a wide variety of incontinence issues in both men and women.